Okay, I think we will make a start. The numbers seem to have settled down a bit now in terms of people joining. I'm sure a few more colleagues will join us in the next few minutes. But welcome everybody today to our webinar on damp and mould in the home, a public health issue. I'm delighted that you've all been able to join us this afternoon. My name is Julie Billett. I'm the Deputy Regional Director in the Office for Health Improvement and Disparities London regional team. We're a part of the Department of Health and Social Care, and I'm really delighted that we're joined by a fantastic collection of colleagues and speakers today to tell us some more about damp and mould as a public health issue. Just to briefly run through a few housekeeping matters, if that's okay, colleagues. I'd really invite colleagues to remain on mute, please, and turn your cameras off. I know normally we encourage people to have their cameras on, don't we, for interaction, but just so we can see panel members really clearly when they're speaking, that would be really helpful. We've also tried to manage receiving too many kind of Q&A activity going on in the chat by inviting colleagues to submit questions in advance. So through the registration process, many of you have submitted questions which we have collated and gathered, and we'll endeavour to work our way through as many of those as we can today as possible. Those that we aren't able to answer, we will be looking to compile a sort of FAQ type document afterwards, and we will circulate that round to participants. We are recording the webinar as well, and we will make the recording and the slides from all of the speakers available, I think, on the ADPH London, the Association of Directors of Public Health London website as well afterwards, and we will share with colleagues the link to that location as well. Hello, Katie. Could I ask you to mute yourself, please? Thank you. Yeah, just encouraging all participants to stay on mute if that's okay, obviously other than the speakers when they're speaking. So as I said, this is a joint webinar organised with our colleagues from the Association of Directors of Public Health in London, ADPH London, so many thanks to them. We're also very grateful to national colleagues working in Department of Health and Social Care and in DLUHC, as this is a really kind of an issue that really intersects across that boundary of housing and health, doesn't it? Absolutely, that's what we're talking about today. And obviously also colleagues from UK HSA joining us as well, and great to have colleagues from the UCL Centre for Access for Justice as well, bringing a real kind of legal perspective to particularly sort of working your way through raising issues and the complaints associated with damp and mould and that process. So hopefully a number of sort of angles and perspectives on this issue that we will consider today. We're going to start off with a series of presentations from colleagues, and then we'll move into about a 40-minute panel discussion. If we get through the questions in good time, we may end a little bit early, but we will see how we go. So without further ado, I am going to pass the baton on initially to Professor Sani Dimitropoulou. I'm sorry if I've completely mangled your name,
That's
Sani.
Fine, no worries.
From the UK Health Security Agency, who's going to give us tell us about some work that you've been leading, Sani, on understanding sort of the prevalence of health-related issues associated with damp and mould. So thanks very much, Sani.
Thank you very much, Julie, for the introduction. And yes, in the next 10 minutes, I will try to cover the area on the health effects associated with exposure to damp and mold. Next slide, please. So following the tragic death of the 2-year-old boy, Wabishak, who died from a severe respiratory condition due to prolonged exposure to mold in his home, and also in response to the coroner's concern that there was no up-to-date information on the health risks of damp and mold that was accessible to the housing sector, the government developed a guidance on the health risks of damp and mold in the home. That was a collaborative effort between the Office for Health Improvement and Disparities, us at the UK Health Security Agency, and the Department for Levelling Up Housing and Communities. And of course, my colleague Josie actually is going to say more about and present properly the guidance. Next slide, please. However, in this guidance, we provide information on the health effects of damp and mold. So living in a home with damp and mold can affect the occupants' airways and lungs, and can also cause serious illness and unfortunately, in the most severe cases, death. And this is because damp and can lead in the mold actually in home and can produce allergies, irritants, mold spores, and other also toxins that are harmful to health. And now respiratory effects include the general symptoms such as cough, wheeze, or shortness of breath. Also increased risk of airway infections, development or worsening of allergic airway diseases such as rhinitis, asthma, or other conditions that involve inflammation of the airways, for example, bronchitis or COPD. Other physical health effects, including irritation of the upper airway system, eyes, nose, throat, but also skin infections, fungal infections. And finally, living in a home with damp and mold can also affect tenants' mental health. And this is due to unpleasant living conditions, destruction of property and belongings, anxiety, which is related to physical health impacts, or also frustration from poor advice that they are given, or social isolation because they don't really want to have visitors in their own homes because they are really embarrassed to do so. Next slide, please. So in order to inform the guidance and the health side of the guidance, we carried also out a respiratory burden of disease. It is an environmental burden of disease assessment. And there are really different approaches to doing environmental burden of disease quantifications. However, the one that we followed here is very much in line with what it was developed and applied also by the World Health Organization. And it was also popularized on a wider scale by the Global Burden of Disease Project. So in our approach, we use the population attributable fraction, which requires information on the population exposure distributions, or in other words, the percentages of homes with damp and mold. Also, epidemiological evidence on exposure response functions, national data as well, and all these are combined in order to estimate the attributable additional cases and also the burden of disease at the population level. Next slide, please. So in our case, we use data, in our assessment, we use data from 2019 because that was the most recent year with both national data, but also burden of disease data and exposure data as well. So we selected two age groups for this quantification, infants and children, 0 to 14, and then from 15 to 49 years old, which actually includes older adolescents, but also adults. So the age grouping was based on, first of all, epidemiological evidence, the evidence that we had, and also the age which were captured in this evidence, also on national health data, and finally on exposure data. Next slide, please. So on the exposure data side, we relied on the English Housing Survey, which provided the percentage of dwellings with any damp. And for 2019, this number was 3.4%. However, there is a great uncertainty in the exposure distribution. And there are some reports. The first one that I would like to mention is the Healthy Homes Barometer report of 2022, which reported that 14% of homes in Western Europe, including the UK, had damp and mold, and that was based on a pan-European survey. And furthermore, there is the Energy Following Up survey of 2021, which surveyed a representative sample of homes back in 2018 in England, and estimated that 27% of dwellings had some form of damp and mold. So it is much greater than the number of 3.4%, which was in the English Housing Survey. Next slide, please. On the epidemiological side and on the exposure response relationships, in order to identify them, we carried out a systematic review of the epidemiological literature, and we focused on the meta-analysis or on the longitudinal cohort studies. So based on that, we managed to calculate the primary estimates for asthma and also for the lower respiratory infections, which are associated with damp and mold. And we estimated also some secondary, we calculated, sorry, some secondary estimates for bronchitis and also allergic rhinitis. Bronchitis is a subtype of lower respiratory infection, so it was included as a secondary estimate and not as a primary one in order to avoid any double counting cases here. And furthermore, we don't really have any burden of disease data for these outcomes. Next slide, please. So using this information and using the 3.4% of homes with damp and mold, as it was reported from the English Housing Survey, we estimated that the presence of damp and mold in the English residencies can be associated with approximately 5,000 cases of asthma, 8,500 cases of lower respiratory infections among children and adults, and contributed to 1 to 2% of new cases of allergic rhinitis in that year. However, if we use alternative data sources, as I mentioned before, and some of them may come also from self-reporting, then the percentage of dwellings which are affected by damp and mold may be even higher than the one that we used in our estimates. And in this case, the total number of cases could be 3 to 8 times greater from the numbers that we provide here. Next slide, please. Lastly, data from the English Housing Survey also show that the percentage of dwellings with damp and mold was higher for dwellings with the least income or where the occupants had a long-term illness or disability, and where the occupant was Black or Asian compared to their counterparts. And this is translated into disparities in the calculated population attributable fractions, which is used actually in our estimates of the burden of disease for these specific groups. Next slide, please. So I would like to close saying that everybody is vulnerable to health effects from exposure to damp and mold, but especially people with certain health conditions, children and elderly people are at the greatest risk of the more severe health impacts. And as this guidance was drafted, we had in mind that also people who are more likely to live in homes with damp and mold, and we had to provide real information for the landlords to consider these issues when they are responding to this kind of requests. And I'm talking about issues which are actually out of people's control, such as the fuel poverty. And of course, all these groups can be intersected because we have also the last group here. And so, for example, we may have someone who has a disability and is also on low income and also live in a house of multiple occupation, for example. So it is really my last slide, please. It is really our duty to work all of us together in order to reduce our exposure to damp and mold. Thank you very much for your attention.
Thank you very much, Sunny. Really interesting piece of work to understand the methodology behind those estimates. And as you sort of say, I think based on what we know about the prevalence of, the variation in those estimates, actually the burden that you've articulated there could be much greater, actually, couldn't it? If depending on what the actual prevalence of damp and mould is, and importantly, that really important message around this is a health inequalities issue, that we see that the variation in the burden of damp and mould related health issues falling disproportionately on people living in more deprived communities, and particular ethnic populations, for example. Absolutely. So yeah, really helpful. Thank you, Sunny.
Thank you.
So I'm going to bring our next speakers forward for the next part of the agenda. So delighted that we're joined by Josie Olsings-Riding. Josie is the Housing and Health Programme Manager in the Department of Health and Social Care. And Josie has been really instrumental in helping develop that guidance that Sani referenced, and is going to talk more about that guidance in a moment. And then we will turn to Luke Spanton from the Department for Levelling Up Housing and Communities, who is the head of cross tenure standards there. So I think, Josie, you're speaking first, if I'm correct.
Yeah, thanks, Julie. Thanks for that introduction.
And Josie, just to say, I don't know whether it's your camera position, but I certainly can't quite see you. I can see that little slither of the side of you. So that's perfect. Are you miles away from your screen now? There we go.
No, I'm okay. But yeah, thanks for flagging that. Brilliant. Okay, so just before I kind of talk you through the actual guidance on damp and mould, I wanted to provide just a bit of context on damp and mould beforehand. So next slide, please. So kind of as Sani touched upon, the estimates of kind of damp and mould prevalence, it's estimated to affect between 962,000 and 6.5 million households in England. So even with that kind of lower estimate, it's very clear that it's a very, very widespread, significant issue affecting the health and well-being of people in England and more broadly. So we know that people living in private or social rented housing are particularly likely to be living in a home with damp and mould in comparison to owner occupiers, although it is a significant issue kind of across all tenures. And each year, the NHS spends an estimated £1.4 billion on treating illnesses associated with living in poor housing, which includes damp and mould and sort of associated issues such as cold housing, with an estimated broader cost to society of £18.16 billion per year. So the challenge here from a health perspective is just absolutely phenomenal. So next slide, please. So I think Sani's already kind of touched on some of the background to the guidance, but just to add that the guidance, although it's kind of primarily aimed at private and social rented housing providers, there's a lot of information in there that is really relevant to health and social care professionals, as well as tenants and owner occupiers. And that the guidance was developed, as Sani mentioned, in collaboration with UKHSA and DLUHC. And it also involved an expert advisory group of kind of experts and representatives from landlords, tenants, academics, experts on building design, environmental and public health professionals. And we consulted with kind of over 200 people as well to kind of to produce the guidance and capture kind of all of the health risks and the housing context. Next slide, please. So I won't go into the detail on this particular slide, but I'm just going to kind of outline the different sections of the guidance and roughly what it covers, just to give you a flavour, really. So the first section is on the health risks of damp and mould. And yeah, so this section will be both relevant to landlords, but also health and social care professionals who want to understand the risks and kind of what signs to look for in terms of the people that they are supporting. And also just to flag that the London Damp and Mould Toolkit, which you'll be hearing about shortly, is also very much in keeping with the health risks in the national guidance. So that's the first section of the guidance. Next slide, please. So again, I won't talk through this in detail, but the second part is around just identifying vulnerable groups. And again, we hope that's really useful for you as health and social care professionals and for landlords. Next slide, please. So this section of the guidance covers landlord responsibilities in relation to damp and mould. It outlines relevant legislation. So that is things like the Housing Act, the Environmental Protection Act, and the Decent Home Standard. And we feel that this should be really helpful for tenants and people supporting tenants to understand what protections there are in place and what expectations there are of landlords, so that they can kind of take action if they need to, if their landlord doesn't address damp and mould in their home. Next slide, please. The final section of the guidance talks through in detail what landlords should do when responding to damp and mould. So this has been written with a real focus on not blaming tenants and on landlords tackling the underlying causes of damp and mould. So that could be things like inadequate ventilation, leaks and other structural issues, first and foremost. And the focus is really on being sensitive to tenant circumstances and understanding that the impact of damp and mould may be having a really significant effect on both tenants' physical and mental health, and to respond sensitively and keep tenants informed in kind of what they're doing to address the issue, timescales, things like that. There's also a lot of guidance on what landlords can do to actually prevent damp and mould from developing in the first place. So one section is around what to do once the tenant reports damp and mould, and the other is around how can we actually minimise damp and mould in the housing stock in the first place. What processes can they get in place and systems for kind of monitoring their housing stock and taking a more preventative approach to protecting tenants. Next slide, please. So the guidance also links to a number of resources. So that includes support for housing and health professionals. So that's sort of training and resources on damp and mould, which will help whoever's reading it to kind of best support tenants. As the guidance was kind of aimed at housing professionals, that's kind of how it's framed, but there are a lot of resources in there still that would be of equal relevance to someone working in health and social care. So we'd really encourage you to read those. It also includes some links to support actually for tenants themselves. So we know that, for example, not being able to heat a home is a risk for developing damp and mould. So there are lots of links and guidance in there on sources of financial support with energy bills and support with energy efficiency improvements as well to kind of make homes warmer. And finally, the guidance also includes some information for tenants to understand how they can reduce their risk of damp and mould. And it also provides links to kind of tenants' rights in relation to damp and mould and kind of the expectations of landlords. And yeah, there's some great resources in there. So yeah, next slide, please. This is just a bit of an overview of some of the feedback that we've had so far. So yeah, just to take a couple, the guidance is very clear that tenants should be not blamed for damp and mould in their home. They are absolutely not the result of lifestyle choices. And another quote, that healthcare professionals can benefit from this guidance. It provides valuable information on the health risks associated with damp and mould, aiding in diagnosis and treatment. And we sort of continue to collect feedback and we'll kind of be evaluating that as we kind of take stock of the guidance as a whole and kind of any future kind of tweaks that may need to be made. Next slide, please. Yeah, so finally, just to say, please do read the guidance and share it with your networks, and that we'd really welcome any feedback that you have on the guidance. So we've included our Healthy Places email in there. And I'm just going to pass over to Luke now, who will set out some of the wider context in terms of what's going on in terms of housing reform. Thanks.
Thanks, Josie, and thanks everyone for coming along. My name is Luke Spanton, lead on cross-tenure standards here at Department for Levelling Up Housing and Communities, so standards in socially rented homes and privately rented homes in the context of our review of the Decent Homes Standard. And I just thought I'd quickly set out the work that we're doing in both those tenures. I worked very closely with Josie and other DHSC colleagues as we prepared this guidance, representing the sort of departmental side. So we're doing a number of things at the moment. We're reviewing the Decent Home Standard. Now, apologies for anyone who probably already knows this, but the Decent Home Standard, the standard that social housing must meet. We're reviewing that standard. We're introducing that standard to the private renter sector. for the first time. We've tabled amendments to the Renters Reform Bill that's currently going through Parliament, and we have consulted on that. And as part of the Decent Homes Standard, we are considering how to address damp and mould specifically as part of that standard. I'll come into a little bit more detail on that in a moment. We're also introducing something called OHID Law, which is a new piece of legislation. Again, I'll cover that in a little bit more detail in a moment. And we're reviewing the risk assessment tool that we currently use and that local government uses and that housing associations use to assess hazardous conditions in their homes, the Housing Health and Safety Rating System. So to start with the Decent Home Standard review, we've made a commitment in a couple of white papers to halve the number of houses, rented homes that don't meet the Decent Home Standard by 2030, and that includes privately rented homes that don't currently have to meet the standard. A Decent Home Standard has been in force since 2001. It was last updated in 2006. So we did hear from stakeholders that it's no longer fully effective and it doesn't necessarily meet present day concerns. And of course, we're introducing it to a different tenure as well. So we've worked very closely with tenants, landlords from both sectors, technical experts, and we've now commissioned some analysis to properly understand costs and benefits before going out to consult on a new cross-tenure Decent Home Standard at some point this year. Decent Home Standard in the private rented sector. So privately rented homes at the moment have to be free from the most serious hazards using the Housing Health and Safety Rating System. Those hazards are the most dangerous hazards are the ones that are at Category 1 level. Local authorities have a legal duty to take action against private landlords if they identify Category 1 hazards. Introducing the Decent Home Standard will actually introduce some less reactive and more management aspects to managing your homes. So private landlords will have to start thinking about things like disrepair, facilities, that sort of thing. So there'll be parity across the two tenures. This is, as I say, in the Renters Reform Bill that's currently going through Parliament, and would need regulations to set out how this works. So when it comes to damp and mould specifically, the guidance, as Josie said, doesn't introduce any new requirements. It just sets out and it consolidates guidance that's there at the moment and sets out what the current standards are. But following the death of our Bishak and then the coroner's report, our Secretary of State, Michael Gove, wrote to all providers of social housing. And he also wrote to local authority chief executives and council leaders as the people enforcing in the private rented sector. And he set out his expectation that social landlords go further than they're going at the moment and that local authorities take action to address damp and mould as enforcers. He then asked us, as part of the Decent Home Standard review, to explore whether damp and mould could be addressed through a minimum standard. At the moment, it's addressed through the Housing Health and Safety Rating System. As I say, a damp and mould hazard would be assessed using that system, and the most dangerous damp and mould hazards, the ones at Category 1, would mean a failure of the Decent Home Standard, or in the case of privately rented properties, would mean local authorities have a duty to take formal enforcement action. A new minimum standard would be different. It would mean our expectation would be that all landlords, private or social, address damp and mould when they see it, but there would be a minimum standard, and an ambitious standard is what we've been asked to explore, a very ambitious standard. We've not been asked to explore standards setting out things like requirements to have ventilation or whatever, but instead an ambitious standard saying, you know, this is the minimum, the maximum acceptable level of damp and mould. Any more than this, and the Decent Home Standard won't be met. I'll move on to OHID Law. So OHID Law was it was a campaign by the Manchester Evening News and Shelter and the family, the Ishak family, campaigned about this. They wanted a law to require social landlords to investigate and fix hazards within specified timeframes. Started as damp and mould. We've actually recently closed our consultation on this, and we actually consulted on all 29 of the hazards that the HHSRS refers to, rather than just damp and mould. We're currently considering the consultation responses. That consultation closed earlier this month, so we have to consider those very carefully. We've had a really good response to that consultation. It sits under the Social Housing Regulation Act, so that has become law, but further set of regulations will need to bring that aspect into force. And then finally, if I can quickly go through the housing health and safety rating system. So as I said, it's a risk assessment tool. It forms part of the Decent Home Standard. One of the criteria of the Decent Home Standard is to be free from Category 1 hazards, and it's also an enforcement tool for local authorities. Again, it's been around since 2006 and it's remained unchanged in that time. We went out to stakeholders, landlords, tenants, local authorities, academics, and we said, what do you think of it? And they said, it's really complicated. It's very hard to engage with. It's very time consuming. But they also said to us, look, it directly connects housing and health, and it allows you to assess properties on their merits, making a specific assessment based on a property. So we've carried out a review of it, to try and consolidate it a bit, to try and make the actual process of using the tool more accessible, to make the tool more useful. We've completed that review. We do need regulations to bring the conclusions of that review into force. Again, that's as parliamentary time. Yeah, we're working on those regulations at the moment as parliamentary time allows. I can go into more detail on the HHSRS, and I probably will, because it's subjects that I do enjoy talking about. But I will try to keep it specific to the questions that we're asked. So that's the DLUHC side, the wider context, the sort of legislative framework of which all this sits in. Back to you, Julie.
Fantastic. Many thanks, Josie and Luke. Really helpful overview of the new guidance, but also that wider sort of legislative context and changes that are taking place. So many thanks both. So I'm now going to introduce Gladys Xavier. Gladys is Director of Public Health in Redbridge, London Borough of Redbridge, but she's also the lead for housing and health on behalf of the Association of Directors of Public Health in London. And Gladys and a range of colleagues have been involved in a piece of work in London to really think about how we can support health and care professionals to engage with this issue around damp and mould, and support them to work with clients and tenants who might be facing health related issues associated with damp and mould. So over to you, Gladys.
Thank you, Julie. Next slide, please. Thank you. So I just want to put it into context, start with really just what is the problem. So we've got some data on the English Housing Survey. 4% of households they live in a damp problems. So it's really mostly private rented house sector is more likely to be associated with damp than social or owner-occupied households. Overcrowding is an issue. So when I talk about overcrowding, I'm not just talking only about people. I went with one of my environmental health colleagues to visit a house. So it's not just about people, it's animals, plants, washing, drying in the same room. So that really is an issue. Next slide, please. Okay, so damp homes and health, and I won't go into too much because some other colleagues have already gone into this. According to the survey, most people spend about 80% in their house indoors, so that's an awful long time. So damp is really, I think I used to live in a flat, and I do remember having damp in my own flat. So I did not think it was an issue. But if you continue living in a damp environment, it's the presence of unwanted moisture that goes diffused into the air, and then condensation and damp in homes can lead to the growth of mould. So this is really the start of damp and then the mould. Next slide, please. Okay, so we looked at the data. It's actually, as colleagues have said, 6% of households with dependent children lived in a house suffering from dampness problem compared to 3%. So it really does affect young families. Next slide, please. So what are the drivers concerning about this? So I think we've already know, because when, as public health colleagues, when we saw the coroner's report, I think in public health, we always ask, because that was we all were so affected. And we said, how do we stop? How do we look at it with a public health lens? So we started with prevention. We want to look at secondary prevention and tertiary. So these are the things that were the drivers for us. Next one, please. Next slide, please. So just to talk about, again, is just how the story started. I was talking to Julie. We started these discussions in 2022, so that we only produced the toolkit or the checklist only sort of last year. So it's taken us a long time to do that. So, but lots of things have happened since then. Next slide, please. Okay, so this is what the developing of the damp and mold risk assessment. So first of all, what we did was a group of us, not just public health professionals. We also looked at wider housing officers, environmental health officers. Together, we said what is out there. And we also talked to GPs, pharmacists, us, health and social care, and also our voluntary sector. What we found was there have been some, what they call a risk assessment, but that's specified for certain groups of people rather than something that you can use for all of them. So what we wanted to develop something that can be used by anyone, anywhere, by any local authority. So we brought that together and we produced this. It was tested widely, and I must give acknowledgement to the Association of Environmental Health Officers. And also the chief execs in London. We talked to everyone and GP colleagues as well. See, will it work for you? So the feedback we had from GPs was, well, we know who is at risk in homes, but what do we do about it? So that was so we looked at all that and we produced the checklist. Next slide, please. So I'm sure all of you have seen the checklist. So when we were producing the checklist, people also wanted some visual about what does damp and mold look like, because we all already have seen on television the extreme, the black and the green mold, but we also, because mold is everywhere, it's nothing, you know, it's indoors, it's outdoors. So what do we know about mold? So we produced a fact sheet. The fact sheet is used quite a lot. And then we went on to sort of, the next step was about identifying who's at risk. I think we've already gone about who's on risk, but we also identified pregnant women, people who smoke, over 65s. So we really targeted who are the people at risk. And when we're doing the risk assessment, we also had police officers. They said, well, if we had a risk assessment tool, we can check as well. So really, then how do you manage? Who do you tell? The first thing was whose responsibility it is. I think Lucas is a landlord responsibility. And I think when we first started, the overwhelmingly healthcare professionals said it's a local authority, regardless of where people lived. So it's really bringing those stories across, and also the tertiary. Once you've identified, how do you manage? Because it is a big issue, so we need to do that collectively. I've just come back from our ICB partnership meeting, and they're really excited because this is one piece of work where we can collectively work together. So I'm really excited about that, the tool. So some work is being done by 8 pilot sites in London. And so far, the feedback we are getting is really, really very positive. They have all got their toolkits on their websites, where to inform and how do you access the toolkits. Next slide, please. So this is just a brief overview of this. The next one, please. I just wanted to finish off with a case study. This is a true case study in one of the boroughs. Just to TT, it's a person who was admitted to hospital with stridor, which is really a high-pitched squeaking and whistling sound, usually due to some obstruction. It's really a sign of an underlying medical condition rather than a diagnosis or a disease. Lives alone in social housing. Home environment risk assessment was done, condensation, damp, mold. And also the person was discharged home with life-saving equipment and wasn't known to social services. So what really enabled them, using the checklist, to bring them together and also access other support through the warm home discount service. So each borough, if you look at that list, we've got a link to lots of resources, but we've also tailor-made it to each individual borough. So in Redbridge, we have got access to food banks and also for baby banks and lots of other resources. We've included them. So it's there's quite a few case studies like this now. Next slide, please. So this is really summary. I think, as I have said to you, it's a critical determinant of health, and it should be seen as a public health issue. So looking at it from a public health lens, and really to bring all partners together, not just one group of people. So really working together. One feedback I have heard from London boroughs, because mainly I'm used to, because we've been promoting the tool in London, where environmental health colleagues and our housing colleagues have said we're working a lot more closer with our public health colleagues, and also we're getting a lot more referral from GP colleagues. So that's, for me, is a really good positive impact. I think that's all my... Thank you.
Terrific. Thanks, Gladys. And yeah, just a reminder for colleagues joining today, we will circulate all the slides round afterwards along with the webinar recording. So you'll have all of those details and references. Thanks, Gladys. That's great. And a great example of sort of partnership working, really sort of showing, some of the opportunities of an integrated care system work, bringing public health together alongside environmental health, housing and health colleagues to address this kind of issue. So our final speaker before we move into our panel conversation today is Tul Khan. Tul, delighted to have you join us. Tul is a housing solicitor working at the UCL Integrated Legal Advice Clinic. So over to you. So thanks very much.
Hello, hi, thank you. So thank you for having me, everyone. So I'm just going to do a very quick run through by way of a case study. So sort of typical case that that comes into us, and how sort of with health practitioners, what we can do to sort of progress this case. Next slide, please. So our client, Mr. Joe Bloggs, he so it's quite typical. So he keeps coming to his doctor due to a sick child, and the GP is concerned it's linked to damp and mould. So first question is, what duties? So first point, is there any duties for the landlord to carry out the works or do anything? Next slide, please. So legal duties in a nutshell, I think it was touched on a very great previous slides before. So I would say the central piece of legislation is the Fitness for Human Habitation Act. Just because this act has kind of revolutionised disrepair in terms of obligations, whereas before it was quite hard, it was very hard to prove that condensation and damp was a result of the problem with the property, and condensation dampness was something that landlords would try and blame tenants for. This new act has now meant that the only requirement that it continues to be fit for human habitation, and the law sets out very clearly that hazards and concerns does include damp and mould. Also, when looking at duties, there are previous laws in terms of structure and exterior. What I would say as well as a starting point, it's good to look at is also tenancy agreements as well. So it does sometimes set out obligations for the landlords, which can actually be much more sort of generous. For example, keeping the properties or standards in good condition. Yeah. Next slide, please. So in terms of noticing, so I think if I just start from the basis that because it's always good to address this at the start before it gets worse. So when sort of Joel Bloggs in this situation notices damp, what should he do? I would also say take photos straight away, report it as much as you can. There's no requirement that whoever the landlord is, that it has to be done in a specific way. So it doesn't have to be done in a formal letter or recorded delivery. Just taking photos, sending it by if there's a housing officer or someone that can accept messages even through WhatsApp electronically, then do that. The key thing is keeping a paper trail, because when it comes to taking action, if there's clear evidence that it has been reported, then it's good for sort of when lawyers do pick up the case. So yeah, photos, videos. I even find sometimes advise clients to keep a folder as well, so dates where how organised you are. So if you can maybe work with patients as well about that, help them to keep sort of evidence together. Also, even just talk around. So if it's especially tenants who live in sort of block of flats, it could be sort of communal issues regarding sort of issues of heating and damp caused by lack of ventilation. Yeah, speak to neighbours. See if there is any residents groups as well. May speak to the tenant, or even through the local community if if you see a pattern of issues or complaints, then again try and get together, because again it could be a group action. The last section about mitigating loss. I mean, what I would say is, as the previous speakers have said, this is very much not, shouldn't be a case where tenants have to come in and show that they've try to deal with it themselves. When I sort of said about mitigating, it's whatever reasonable to do. So obviously, if you can wash off, if you ensure you do turn on the fans when cooking, try to ventilate where you can. There isn't like a threshold that they should meet. You do get landlords who try to use this as a defence, but invariably, it doesn't work. Next slide, please. So in terms of the sort of GP or health advisor, what role they can do, I think we referred to the checklist that has been rolled out in London. I hope it has been useful. There are templates that we've tried to incorporate to make it easier for health officials. I know how busy everyone is. You see lots of patients, and we've tried to find a way where you can use a template letter and just literally just fill in the gaps with the details and have it ready to be sent out. So that's the main thing to do. One of the letters, we have adjusted the letters if it's a social landlord or a private landlord as well, and also even a letter to environmental health. So at the very least, all you've done, is that you have made the request. So you have reported it to the various bodies. If obviously we'll go on to what happens if there's no response, but that's the main thing to do. And also in terms of what you can do in terms of supporting letters, again, just the letter doesn't have to be detailed. It's just to say, now this is the patient you're seeing, this is what you were treating them with, because the test is not just actual harm, there's also risk of harm as well. So, it's doesn't need to be at a stage where there is actual evidence of harm is also a risk. So obviously pre-existing conditions, being a child, living in sort of crowded conditions, that kind of thing. So that'd be really good for when it then comes to getting legal representation. Next slide, please. So in terms of what should happen, so right, the letter's sent out to landlord, inform them, putting them on notice of damp and mould. What should actually happen? So so landlords should investigate. So it shouldn't just be a case of, well, thanks for that, and we're just going to paint over. They should involve actually hiring professionals to actually inspect the property and giving an opinion. So there should be some kind of evidence that it has been looked at, and this is what's been found, and also some sort of timetable or what works needs to be done. Obviously, that should include inspections. You'd always advise tenants, if they do come to your patients, to say, look, if the landlord has asked to come in. What I would say about inspections and access, landlords should give reasonable notice to inspect or for access. Should be at least 24 hours. So I know you have situations where they turn up unannounced and they use that as a reason to say, well, look, we try to sort of deal with it. Again, that's not good enough. They're entitled to reasonable notice. And if they leave calling cards as well, they say they do. Sometimes that's not the case. So, sometimes, just bear that in mind. Again, if the action's not been taken, again, still continues to build up evidence. Don't feel that if a letter's been sent out, you can just stop reporting and keeping your evidence. Next slide, please. So what can be done if nothing happens? So as health professionals, again, not really much more. I mean, if you send the initial letters, the template letters, you can obviously, and I know how busy you are, I mean, you can send a further letter just to reiterate what's the impact it's had. You can go through complaints procedures before going and taking sort of formal legal action. So this is primarily directed at sort of social landlords or housing associations or local authority landlords. There are formal complaints procedures. It has advantages in that it's, a lot of it is just online, so you can just submit online a complaint. Again, there's a paper trail, and if it's not resolved, then you can ultimately proceed to a housing ombudsman. What I would say to those cases is, if there's more urgent cases, so where heating's been stopped or significant damp or real effects to health and it needs immediate action, I would say to still submit the complaint, but also do escalate it through representation, because it may actually involve potential court action. Because with complaints, there is a timescale. So normally it should be like 10 working days for stage one, and it could be just you can't wait for that. Again, also, I think it's been addressed before about environmental health officer as well. So that's something, again, we've got a template letter to request an inspection if there's a risk. Because the reason why that's good as well is because there's powers that local authority has in terms of serving notices on landlords for failure to actually keep property free from hazards. Next slide, please. So what you can do then, if obviously nothing does happen, or what typically does happen more likely is that you will get some kind of response, but it's not really significant. So you may get a time where they will address certain issues, and it's patchwork. So what you find a lot is that they will address that, maybe just do, might just buy those paint, those anti-mold paints you get from B&Q, and it comes back in again. It resurfaces the same issue. So you get patients who return. I think at that point, you need to obviously address, there's obviously an underlying issue that of the property that they're not fixing, not addressing. So I would say at that point, you do need to see, try and get sort of legal assistance. There's a link to find legal aid solicitors. Legal aid is available for all disrepair cases where there's a risk of harm. So basically what that means is that you have to show that there's because of the damp or disrepair, there's a potential risk of harm. So it's not serious risk, serious harm, it's just serious risk of any harm. So the threshold is low. Again, how you can help sort of legal professionals is if you provide us the short letter. I mean, there's a template as well, just to set out to say, there is sufficient risk of harm. This is why. So it could be, again, the children in the home, underlying issues, physical and mental as well. Okay, so it's very, very wide ranging. Next slide, please. So in terms of if there is a legal issue, or when does a legal issue arise? So, like I said, I mean, it's quite low, really. I mean, if there's been damp or disrepair has not been fixed, again, it's reasonable time. But it depends on the urgency. Then there's likely to be a claim, and again, a claim could be not just a claim to get the works done and compensation for it, but also for personal injury. So that's something to bear in mind. So you can claim, make a claim for personal injury, physical, mental health. Next slide, please. So in terms of what a solicitor can do to get involved. So again, so what's really useful for representation through legal aid is it includes paying for an expert surveyor. So obviously, with these sorts of cases, evidence is important to establish that there is disrepair or fitness for habitation issues, and also about liability in the event that a case needs to be issued. So a solicitor can pay for a surveyor's report, and through correspondence with the landlord, if a case does need to be issued at court, it will pay for funding of that as well. Just something to bear in mind is obviously limitation as well. So in these cases, can take many years to resolve, even with legal representations. But don't feel afraid to reach out earlier, because there are limitations in terms of when a claim should be issued. And just general advice as well. I mean, most lawyers, I appreciate outside of London there may be advice deserts, maybe it's sort of more difficult to get sort of a case, someone to look at the case and take on the case, but there obviously are, work with obviously local organisations, and also I can assist as well in terms of outside of London. One other thing as well, just quickly, I know this is all about remedying and dealing with damp and mould, but also, and this is a completely understandable and complete accurate course of action, will be actually getting rehoused. So you have patients who actually lived in particularly private rented accommodation or even social housing, who just want to move because of it. Again, there is assistance available. There are routes available primarily through the housing waiting list. So that's living in insanitary housing conditions is actually by law a factor that local authorities have to give priority on the waiting list. So again, solicitors can advise and try and increase priority to get patients moved up and securing a damp-free property. Next slide. And I think that's it. So great. So thank you for my time. Thank you.
Terrific. Many thanks. Really helpful and some really sort of practical advice there. Tools for colleagues to consider, both sort of health professionals as well as sort of landlords and housing providers. So thank you very much. Really helpful. So colleagues, thank you all for those presentations and contributions. We're going to move now into panel discussion, and I've got lots of questions, so we'll see how we get on in terms of working our way through some of the questions that colleagues have posed. Luke and Tool, I don't know whether you can come on camera again. I can't see you, but maybe that's just my screen. And if yeah, brilliant, that's terrific. Thanks very much, colleagues. So Sani, I'm perhaps going to start off with one for you, but bring other colleagues in as well. Really around sort of the use and linkage of data from both sort of health and housing as a way of really targeting and pinpointing areas or housing estates or particular communities where there might be a particular increased prevalence or risk of health-related issues associated with damp and mould. And I didn't know whether you've given a great example of sort of trying to understand prevalence and scale of the burden at a national level, and I didn't know whether you or other colleagues have got any thoughts about sort of good practice or examples of doing some of that data linkage to really inform and help action more at a kind of perhaps a local level.
Thank you, Julie. Yes, as you said, actually, we did our assessment, this respiratory burden of disease assessment on national level. And we're aware that the English Housing Survey also provides data in terms of exposure data now on regional level. However, I'm not quite sure if we can have access to any local level data because we can identify hotspots only in these kind of cases. And I would say that this question is really a very nice proposal for a research project. It is really excellent, and sincerely, I would love really to work on something like that if I'm able to identify more data on local level. Thank you.
Yeah, fantastic. Thanks, Sunny. Gladys, and then Josie.
Thank you, Julie. I think locally we looked at some emergency department really sort of in relation to asthma admissions. And then we linked it to the most, as Sunny mentioned, the deprived parts, the wards in our borough. And that's how we linked it in, but at very small level. I think every borough is different. And that was quite right, which was very, very, very evident. So we could do some targeted work.
Yeah, thanks, Gladys. Josie?
Thanks. Yeah, so just to use an example of how we've used data to target national funding, we, sort of Department of Health, are working with DLUHC on a project called Healthy Homes. So that's a project with 40 local authorities with a specific aim of improving enforcement on damp and mould and improving tenant health. And to target those local authorities, we specifically based it on estimates of non-decent homes and data on specific health conditions in different local authorities. But Sunny's right, there are lots and lots of challenges around collecting that data, and we use non-decent home data because we don't have that nuanced local level data on damp and mould specifically, so we have to use kind of proxies, but it's still sort of an attempt to try and target those most in need, and the kind of longer term output of the project will be around sharing best practice from that work to try and help targeting of local initiatives, so hopefully there'll be some learning from this piece. Thanks.
Perfect. Thanks, Josie. That's really helpful. And obviously, sort of use of, as I think Luke, you were saying, is the decent home standards obviously only applies to the social housing sector, doesn't it? So that will be missing what's going on in the PRS, won't it? But nonetheless, a useful approach. Luke, come on in.
Yeah, just on that point, yeah, you're absolutely right. The decent social housing is the only rented tenure that has to meet the decent home standard. We do use it as a measure for all tenures, though. The English Housing Survey, which is available on gov.uk, puts all tenures against the decent home standard.
Yeah. Luke, while you've got the floor, I was just going to ask you to perhaps sort of elaborate a bit more on sort of the roles of tenants versus the roles of landlords. I think, as colleagues have emphasised throughout a number of presentations, the new guidance and the new sort of approach is very much about not blaming residents and residents' behaviour, saying that damp and mould is a lifestyle issue, and really putting the onus on landlords to investigate and respond to issues. But can you say something a bit? We've had a few questions about, what is it reasonable to ask a tenant to do? Can they be expected to reasonably, adopt, follow certain behaviours, I suppose, that may help prevent and mitigate the emergence of damp and mould? Is it reasonable to expect a tenant to do some removal of some very small amounts of mould, visible mould in the home, for example? So perhaps could you just say a bit more about sort of roles and responsibilities?
Yeah. Well, yeah, so as I said out earlier, the current standards are that properties have to be free from the most serious category 1 hazards, so damp and mold at that most dangerous level. We're exploring a minimum standard. What we're not exploring, and what the HHSRS doesn't say at the moment, is different people, these are the things you must do. You must install ventilation to this level in a bathroom, whatever. It doesn't say that. It just sets the standard, and it's up to the landlord to work out the most appropriate way of addressing a problem that might exist. The HHSRS, the Housing Health and Safety Rating System, is due to a deficiency, looking at a deficiency in the building causing that hazardous condition. So what the guidance does is it tries to move it away from what we were seeing with some not all landlords, not all landlords by any means, but with some landlords, which was the first step was to say, okay, well, the tenant needs to change their behaviour. Actually, what a landlord should be doing is ruling everything out before they get to that point. They should look, is it penetrating damp? Is there an issue with the rainwater goods? Is the gutter blocked? Is it rising damp? Is there a breached damp proof course? The cavity wall, has that been insulated? And there's some kind of cold bridging. There's all sorts of things that you need to rule out first when you're the landlord before getting to the point, which is in many cases, in my experience, I used to actually enforce standards for local authorities before I moved into this role. In many cases, that point is actually a lot further down the road than a lot of landlords realised. What our guidance says is you do need to work with tenants. While it's unreasonable to blame them for damp and mould in the first instance, actually tenants can make small, reasonable adjustments to their behaviour if appropriate to reduce damp and mould. But it's the way that landlords do work with tenants that's very important, to help them understand what changes they can make, if relevant, to reduce risk, to work together. What our guidance doesn't do is set out step by step how to remedy damp and mould, but that's because there is stuff out there. Industry in particular has produced some interesting open source stuff. I don't want, we're not the BBC here. I can mention particular companies, but other guidance is available. But for example, there's a facilities company called Bailey Gardner who have produced an open source flowchart that landlords can work through, ruling out all the steps before you get to the point at which the tenant might be helped to modify their behaviour. What our guidance also does in Annex E, which is really interesting, I think, and really useful, is set out lots of guidance for tenants on damp and mould as well. So I think landlords of all stripes, private and social, if they use the guidance and if they work with tenants in this way, they should really hit the right notes there. And we're under no, we're not saying this is going to be easy, and we're also under no illusions about the impact the cost of living crisis has on this sort of thing. But I think the guidance does set the right level, and we are very keen to sort of point landlords to those relevant sections in it.
Thanks, Luke. Really helpful. I'm going to come back to sort of health colleagues, so perhaps Sani, maybe Gladys, if you've got thoughts on this. I've had a question about has the potential risk to residents' health from mould been overemphasised compared to the actual risk to residents' health from persistent damp and cold? So just any sort of reflections on whether we're over-egging the importance of damp and mould as an issue. Sani, any thoughts?
Yes. Well, in my humble opinion, the health risk from exposure to mold is not overemphasized. On the contrary, it is underestimated because there is a great uncertainty regarding the exposure data, as I saw actually in my presentation. Furthermore, both excess cold, as it is mentioned, but also damp and mold growth are both of them category 1 hazards in HHSRS. And regarding now the actual numbers, I would say that according to the English Housing Survey again, the homes with damp and mold have been estimated to be from 4% up to 27%, which in actual numbers, this is 950,000 homes up to 6.5 million homes. And at the same time, the homes with excess cold is about 650,000. According again to HHSRS. Of course, we have different health endpoints. For example, living in a home with damp and mold, of course, can exacerbate asthma in terms of causing allergic reactions, can lead to the development as well of asthma. On the other hand, living in a cold home can worsen asthma. and increase the risk of heart diseases in this case, or cardiac events, or musculoskeletal conditions such as arthritis. So if we really want to understand, I would say, in order to conclude, the relative importance in terms of risks, I think that we need to carry out a burden of disease assessment using the same data source in terms of exposure data in order to be able to have an estimate of the relative risks of these two category 1 hazards.
Thanks, Sani. So yeah,
Thanks.
more work needed, but yeah, I think key message there is we're probably underestimating, under identifying the health issues associated with mould at the moment.
Yeah.
Thanks, Sani. Gladys, I'm going to come to you. We've had a couple of questions that I think perhaps best directed to you. One around the toolkit, the checklist that London has developed, about how are we evaluating that? How are we assessing its use and its impact and effectiveness? And then perhaps, we've had a couple of sort of ideas around, have you got any examples or ideas around how we can work with, our 0 to 19 services, health visiting, for example, or community nursing around use of the tool? How are you sort of championing it? How are you kind of convincing colleagues who might feel quite stretched already to engage with this, I think?
Yeah, thank you, Julie. I mean, I think just going back to the previous point, I think what Mould has done is brought it to we're talking more about it, because we always talk about when, there's a cold weather plan, we activate it in the winter, but I think what this is a lot more than that. So I think what it has done is brought that to light. But from our perspective, I would sort of working with colleagues. I mean, you talked about evaluation. It's a little bit too early, because at the moment what we are doing is just collecting good practice. So you talked about the 0 to 19. So I think sometimes we need to be very, very careful, because everyone normally just talks about the GPs. Because when I speak to GP colleagues, they already know who's got underlying medical conditions, or what they want to know is who do they refer to. But they're really, primary care is really highly stretched. So we need to really there are other people who go into their homes. So it's health visitors, midwives. We've also been working with midwives when they do the birth visit. So they tend to so what we have done is because that tool, even though it looks quite lengthy, you can actually use it to suit your own needs. So it is about referring it to the right people rather than doing, and also very keen to do some training, which we have already started. As I talked about damp and mould, people don't always understand. They just looked at the very extreme. So how do you clean if you've got mould? We talked about spores. So you can just clean it up. It's from the environment, but then it rests, because the spores rest on surfaces, so you need to clean that as well. So it's those type of training. It'll be a long way, but there's lots of work to be done.
Thanks, Gladys. Yeah, and I think in getting a sense definitely from general practice about real concerns about lots of this workload ending up in their in-trays and inboxes, and I think the purpose of the tool in London was trying to, as you said, broaden out the workforce who could also play an important role and provide some of that health information and advocacy into the process that tool has talked about. I've got a couple of questions here about sort of the workings and processes within local authorities, I guess, and maybe direct these to you, Luke, but others do step in. So a question about what process should be in place within a local authority to enable staff to report mould in residential properties, and then to take urgent action in order to protect people from that exposure. So something about sort of mechanisms for reporting within a local government setting. And then a specific question, which I think you've answered, Luke, but if you could perhaps clarify, does the local authority have a role to protect people from threats and hazards and harms to health, even if the council does not own the property?
Yes, thanks for that. So there's two questions there, really, two sort of separate questions. The local authority has potentially two roles. A local authority who's a housing provider, a social landlord, has to make sure that their properties meet the Decent Home Standard. At the moment, that means being free from the most serious Category 1 level damp and mould standards, amongst other things. So local councils really need to be responding to complaints about damp and mould and addressing it. And that's what our law is going to be doing for social landlords. It's going to be setting out timescales for all social landlords, including local authorities. So local councils will need to have in place procedures for responding to and addressing any complaint when they get it within those timetables. As I said, we've just closed the consultation on that. We're going through the responses, and we will be bringing this into force through regulation as soon as possible. So sort of watch the space really on that one. Can't give much more detail on that. And then the second role local councils have is they are the enforcer of standards in residential premises. So under the Housing Act 2004, if a tenant of a privately rented property or a property that's a housing association says to them, I'm concerned about conditions, they go around and do an inspection and they identify conditions at that category 1 level. They do an assessment using the DHSC risk assessment tool. They have a duty to take enforcement action. They have a range of enforcement powers at their disposal, and they will make a decision based on the most appropriate power. They can require landlords to do works within a certain amount of time. They can in some cases do the works themselves if they think it's particularly urgent. So this isn't just for damp and mould, this would be for other hazards. Or they can even prohibit the use of properties. They have to choose the most appropriate course of action there.
Thanks, Luke. That's really helpful. Tool, I'm going to come and bring you in. I mean, I think again, some of this you covered, but I think there's a lot of information here, and people are sort of digesting and absorbing and trying to understand and navigate all of this. So, So I think a particular question around what steps should a family or household take if they have reported mould and damp to the council and nothing has been done about it and it's getting worse. So what sort of, I suppose, just if you could simplify and reiterate that kind of what's the next step beyond you've raised an initial concern, nothing seems to be happening.
I mean, it's kind of sort of simply said, but it is just trying look to get advice, really, assistance, because you need to enforce it now, basically. So, it's really difficult. I mean, you can potentially enforce yourself, but in terms of through going through the channels where you could actually issue a claim at court, I would say just trying to get legal assistance as soon as possible, because only so much that tenants and health practitioners can report and chase and try and, get the landlords to actually engage. But at some point, you need to just then take action. So that's what I would say. Just moving on to just what Luke said as well about local authority. I know this is probably more to do with residentials, but in terms of duties, I mean, I know you probably practitioners may get it as well. A lot more applicants, people living in temporary accommodation as well. I know they're not rented and they're not sort of really covered by this, but just bear in mind that if you do get patients who are living in temporary accommodation, that there are duties in terms of the suitability of it as well. So if you have patients who do say that, please do, there are duties that local authority should be doing in terms of suitability. Refer them out again, get some advice about it as well. So don't feel that because they're not renting that there's no duties to actually remedy the damp.
Yeah, that's really helpful, Phil. Thank you. Luke?
Yeah, just to reiterate what Tool's saying there, enforcement powers under the Housing Act are for residential premises. They don't specify privately rented or not temporary accommodation or anything. It's just residential premises.
Great, thank you. Sani, I think this is another one for you, because it's sort of an indoor air quality issue, I suppose. So question about some of the advice that you might, or the actions you might take either as a tenant or as a landlord around chemical cleaning of mould or increasing ventilation through opening windows. Some of that needs to be balanced against the other sort of negative impacts on indoor air quality, exposure to air pollution if you're living on a busy road, for example, or the chemicals contained in cleaning products. Can you just say something about how do you think about that in the round, I suppose, in terms of indoor air quality?
Thanks, Julie. Well, I agree that the best way to protect public health is to consider the indoor environment in a holistic way and provide advice on interventions for both biological contamination, as it is the case of damp and mold, but also for indoor air quality and indoor air pollution. And of course, we have different sources in each of these cases. However, the only common intervention, if I can say that, is the provision of adequate ventilation in both of these cases. So, for example, using extractor fans in the kitchen and in the bathroom, and opening the windows, if it is of course safe. And if mechanical ventilation is not used while cooking or bathing or drying clothes indoors, then this is something which is really recommended. So there are always, common things that we can do. There is this common intervention, ventilation, adequate ventilation, provision of adequate ventilation, and making sure that especially the mechanical ventilation is working, especially in social housing and private rented properties.
Thanks, Sunny.
Thanks.
That's really helpful. I'm going to pose a challenging question to answer, because I don't think there are any easy answers. Perhaps, Luke, you might come in first, but I welcome other colleagues' thoughts around sort of the financial implications of all of this, I guess, for local government and for housing providers. We know, local government is facing a financially challenging context at the moment. So, what advice or steer or approach to prioritisation of need and investigation and responding to housing sort of disrepair issues, can local authorities take? I suppose it's a difficult one. I just welcome any thoughts from colleagues on the panel around that.
So if we're talking about housing providers generally, so our Secretary of State has been really clear. He said the priority is that everyone has a safe and decent home. We know that there's competing financial priorities. There's what we're talking about today, decency, damp and mould. There's building safety. And then of course there's new housing delivery. So we know there's going to be difficult trade-offs. I know it's easy for me to say this. What we're saying is that there is discretion for local authorities. They need to make those prioritisation decisions on their spending within the HRA. We're aware of the strain, and we're aware of the difficulties, and so therefore what we say to local councils is if they're facing challenges maintaining a balanced budget, they need to contact this department as soon as possible. I can share contact details for that. When it comes to damp and mould specifically, the work we're doing around a minimum damp and mould standard and around the review of the Decent Home Standard in particular, we are exploring very carefully the costs and the benefits of a reviewed Decent Home Standard, and we are going to be consulting on this, so there'll be an opportunity for everyone, all housing providers, to let us know. And we're also exploring how regulation of a Decent Home Standard can work if for any reason the standard can't be met, and there's a whole variety of reasons for that, and so trying to address that in a nuanced way. I'm aware that's not I'm not giving any easy answers there, because it is a challenging question.
Yeah, thanks, Luke. But helpful sort of pointers nonetheless. And if that, as you sort of say, an approach to the department, if councils are finding it really hard to respond to sort of priority issues around damp and mould. Josie, do you want to come in on that as well?
Thanks. Yeah, just in terms of sort of reducing the financial impact on local authorities from an enforcement perspective, I think it just really does emphasise the need for prevention and the kind of importance of sharing this guidance, and that sort of change in approach sort of permeating throughout the rented sector. I mean, short term, it obviously doesn't help in terms of the kind of number of cases of damp and mouldy properties, but longer term, we would hope that if more landlords take on board the advice in the guidance and conform to kind of new and existing legislation and standards, then hopefully further down the line there will be a reduction in terms of local authority pressures. But yeah, I appreciate that's somewhere in the distance. But
yeah,
no,
really important point, isn't it? The sort of the prevention approach is always in the long run the more cost effective and impactful approach at a population level, isn't it? Absolutely. Gladys.
Yeah, I would really sort of look at the prevention element. And also, I think sometimes we can be quite reactive. From a public health perspective, I would look at it long term. So it's about cost avoidance and cost savings for the local authority, because we know how much it costs. I think I have seen it cost the NHS more than £1.4 billion for treating people with illnesses. And then it's, even if you looked at the wider costs of social care and other costs, it's totals about 15 billion. I know it's an argument you have to put forward, but I think that's the message we need to get out as well.
Thank you, Gladys. Whilst we've got you on the mic, so to speak, we just had a couple of questions about obviously sort of acknowledging the wider challenges that are facing many residents and tenants in relation to sort of fuel poverty, cost of living crisis, which we know is part of the kind of contextual challenge for people in terms of, you know, adequately heating their homes, for example, being willing to put washing machines on, things like that. So Gladys, I wonder whether you could just say something about sort of the types of wider support that local authorities are endeavouring to provide to residents around sort of meeting some of those cost of living type challenges and pressures at the moment.
I think the main issue is sometimes when we visit residents, they're not really sure what they're entitled to. So I think we work with our Rev and Ben's colleagues. It's about how people are, it's really supporting them to claim what they're entitled to, because it's a very difficult one, because people find it really, really hard. But it's not just giving them a link to where they go, but we actually visit them and give them some advice and really signpost them to local services. And also the other group of people that I forgot to mention locally is the social prescribers, because we have now got in primary care, the PCN link workers, and we are also working with them, the wider workforce, again, giving them the knowledge and also informing them where they could refer anyone who needs help.
Thanks, Gladys. Yeah, really important sort of, you know, using that wider workforce to support around some of those sort of fuel poverty, cost of living related challenges as well. Luke, I'm going to just come back to you. It's sort of it was a more of my personal question, really. I just piqued my interest because you sort of, when you were talking about development of potential minimum standard around damp and mould and sort of defining a sort of an acceptable level, I think you said, if I understood you correctly. And I was just curious as to sort of know what sort of format that would take. How would you define a sort of an acceptable level of mould in the home, given it's so sort of contextual in many ways, isn't it? And also depends on some of the vulnerabilities of the householders themselves. So just if you could say a bit more about that.
So as we reviewed the Housing Health and Safety Rating System, which doesn't set a standard for any of these hazards, it requires that you conduct a risk assessment for the hazard, be it damp and mould, be it fire, be it falls on stairs, you know, all the different ways you can come to harm in your home. It doesn't set a standard. It requires that you do a risk assessment, and then based on that risk assessment, the hazard is categorised in the most serious hazards, the Category 1 hazards, the ones at the most serious level. As we reviewed it, we thought, well, would we be able to set standards as well to make it more obvious, you know, what the sort of Category 1, Category 2 level is. So we worked with academics, and broadly speaking, we roughed out for each of those 29 hazards the level at which, you know, the works at which you'd have to do in order to not have a Category 1 hazard. Now, it doesn't map across very well because houses are all different. Not so much with damp and mould possibly, but with other hazards like fire, you might have a very difficult long way getting out of a house. So all properties are different, but broadly we worked out that if you took a property and you had a level of 5% of floor, wall, ceilings, you know, basically all the floors, walls, ceilings of the property were affected by damp and mould, not cumulatively in each room, then that would be around the Category 1 level. So that's still not very good. You know, Category 1's quite it's not a very high bar, really. It's the point where it's very dangerous, but you know, it's still pretty unpleasant if you're not quite to that level. So as we're exploring a minimum damp and mould standard, which we haven't landed on something yet, and we will consult on it, we would look to go probably a lot further than that. Our expectation for landlords would be, if damp and mould is reported to you, you address it. Our expectation isn't going to be that landlords work towards a minimum standard and then stop. But a minimum standard is a useful way of having an enforcement tool, and it's also a useful way of, as we say, setting a standard that reflects the fact that properties are different. So rather than saying, I think I gave this example earlier, but I think it's quite a good example. Rather than saying that the bathroom has to have ventilation at a certain level, as you know, an extract fan at a certain level, well, that might not take into account the fact that it's a large family with older children who are playing lots of sports, so there's lots of people showering. You know, all properties are different. Instead, having an ambitious standard and then requiring that the necessary works for that property are done to meet that standard. When you've got to stop me if I'm talking too much on this, because it's subject to go on about for ages. We do have other examples of standards sitting alongside the HHSRS. For example, rented properties have to have a smoke detector on each floor, but the HHSRS also sets out a risk assessment for the fire hazard. So there are examples. with gas safety, you have to have a gas safety certificate every year. In private rented sector, you have to have an electrical safety certificate every 5 years. That's also assessed on the HHSRS, which sort of covers all bases. It takes into account the properties that are different. It takes into account the fact that a hazard can develop, but it also sets out something that's more sort of easier for landlords to engage with and for tenants to understand where perhaps their property isn't meeting standards.
Sorry, still on mute. Thanks, Luke. Really helpful sort of additional understanding of the kind of the thinking and the methodology in the process. That's really helpful. We've had a very specific question about extractor fans that aren't connected externally, but I think that's one that we'll take away and try and respond to in the FAQs. Also a question about, I don't know whether colleagues have got a view on this, given the impact of damp and mould on health, do you think there should be specific regulation to deal with it, similar to that we have for Legionella or gas safety, for example? Does it warrant regulation of its own, or a colleague sort of, I suppose, is there a sense in which the work that we've been talking about today, particularly Luke, will be adequate to address the risks?
So yes, well, yes. So yeah, I think I sort of jumped the gun a bit earlier when I mentioned, yeah. So you're absolutely right. There are separate pieces of legislation around gas safety, around Legionella, and there are regulations that require a smoke detector. There are regulations that require carbon monoxide detectors. We're exploring all these options at the moment. What we're looking at is, well, we're introducing the Decent Home Standard into the private rented sector. We're reviewing it for the social rented sector. So we're exploring a specific minimum standard that sits under that Decent Home Standard, so that if you don't meet that standard, then you fail the Decent Home Standard. And the requirement is that properties meet the Decent Home Standard.
Great, thanks, Luke. Okay, I'm just having a quick look through the questions. I think we have managed to kind of cover quite a lot of ground there. I think we've covered the majority. I'm sure there's probably a couple that we've omitted that colleagues submitted beforehand, but as I said, we will as part of sort of sharing we'll share the recording of the webinar afterwards to colleagues. We will share colleagues' slides as well, so you have all the slides, and we'll also endeavour to compile a bit of an FAQ, which will enable us to kind of pick up some of those questions that we haven't managed to cover today. I'm just going to pause for a moment and see if there are any final comments or contributions that panel members want to make that you feel like you haven't had a chance to say as part of today's session. So just pause there and see if any other colleagues have got any further final wrapping up comments. Okay, right, hearing none. I think I'm going to draw the webinar to a close there, but I want to finish by thanking my colleagues on the call. So Gladys, Tool, Josie, Sani and Luke, I'm really grateful for your time and contributions. I'm hoping that participants have found that a really sort of useful and informative session. I also want to thank colleagues who've been working furiously behind the scenes to pull everything together. So Shelley, Danielle and Ema at ADPH London, many thanks. We would be really appreciative of colleagues taking literally sort of 30 seconds to give us some feedback on the webinar. If you scan this on your phone, the QR code, that will bring you up to a link to a Microsoft Forms evaluation form where you can just very quickly complete a quick evaluation, and we'd be really grateful for your feedback on that. And with that, I'm just going to thank everybody for joining us this afternoon and wish you a very enjoyable rest of your day. Thanks very much, everybody.
Thank you. Bye.
Thank you. Thank you very much.
Thank you.